Yeah, we spoke to you a few times last year about Healthscope, which launched that aggressive advertising campaign targeting private health insurers, claiming they weren't paying their fair share to fund private hospitals. But now that they've gone bust, were they correct in saying they weren't being funded correctly, or was it just mismanagement on Healthscope's part?
There is no amount of money that health funds or the government could have thrown at Healthscope at that point, which would have made up for the terrible business decisions made by Brookfield from going into the deal with an excessive amount of leverage, paying far too much for a company that already had problems, and then going into a sale in which $2.5 billion of profit from the sale of the property went to overseas investors. So in a situation like that, there is no amount of money that health funds could have put their hands on that would have resulted in a different outcome. And we have to be mindful that at the end of the day, consumers have got to be able to afford their premiums. So the advertising campaign was a misstep. But now that we're in a situation where new owners can take over, I think myself and the private health insurance industry is incredibly optimistic that the private hospital sector will come through this and be able to deliver much more modern and attractive models of care for our patients.
Yeah, we know insurance costs keep rising and premiums rise for consumers as well. Are Aussies starting to opt out of private health insurance now due to the big expense?
Look, we've actually seen tremendous growth in the number of people with private health insurance. There are about 15 million Australians that have some sort of private health insurance. And the reason it continues to grow is because of some of the struggles that the public hospitals have had with waiting lists and ambulance ramping, and people's desire to have more control over when they have treatment and by whom. So we are actually in a good position, and we think that the private hospital sector will emerge from this crisis in a much better shape than it was previously, able to deliver much more modern forms of care, including care in the home.
Rachel, David,
and
thank you for your time. Sorry, we've run out of time.